Since the time you started your career today, how much change have you noticed? And where are we in that journey? Where do we need to go? What work is still left to be done?
There has been some changes. They've been small and incremental changes. One of those changes are becoming more apparent, which is the recognition of the importance of health equity, right? So just making sure all populations have equal access to health care, which means that, we may have to invest in some populations who haven't historically had access in order to bring them to that same level of access that other people can achieve. So that's slowly changing. I think, there are some challenges that remain around system navigation and making sure that people are aware of the points of access that they need to reach out to depending on their conditions, and trying to keep people, again, accessing services in the community, not so much in the hospital and environment, which is great for when you have something acute happening. Hospitals do a phenomenal job with dealing with those things. But then when you're someone who is just well and maintaining your overall health and wellness, there's so many community services that can be accessed to keep people out of the hospital emergency room, which, as we know, is the most expensive point of care in the system.
How much more work do we have left for us?
Well, we've got quite a bit of work ahead. I think the pandemic is shining a bright light on some of those inequities that I mentioned before, where we're looking at, populations who are racialized mainly, who are, some of the most hidden populations, people who are new immigrants. They don't have access in some cases to health insurance coverage. And those hidden populations are populations that we're hoping that will surface in this COVID environment. Everybody needs to come forward, as we know, to have a vaccine, to make sure that, we're all protected and we protect our families and ourselves and our loved ones in the process. So I think the pandemic is certainly teaching us a lot of really valuable lessons that we can take forward as we recover from this pandemic experience.
Speaking of the pandemic, the past year has been one of the most challenging years for many of the leaders out there. How has your experience been dealing with the past year, and how do you take care of your own health, emotional, physical, mental, and support your team when sometimes you yourself might be tired, exhausted?
It's been a wild ride, I would say, operating in a pandemic environment. It's constantly changing, not just day to day, but hour by hour in terms of responding to what's happening in the system. And my organization has certainly, stepped up to respond to the needs of our community by taking on things like COVID testing for some of our other partner organizations, people living in congregate settings. We've had a role in rolling out of the COVID vaccine. We're now going to have a new and different role yet again in supporting people who are COVID positive in their homes through an at-home monitoring program. So we are trying to remain, as an organization, as a staff team, very flexible and nimble, and making sure that we're ready and able to respond to the needs of our community. I would say we're operating definitely in a crisis management mode. I say that because many of us, particularly the team on the front line, feel quite overextended as they're going above and beyond the line of duty each and every day. I do have to say the thing that I have a lot of appreciation and respect for with the team is that somehow we managed to galvanize as a group, have our little internal huddles to figure out what is the best way we can move forward in terms of, responding as part of the broader healthcare system, but responding to our local community and their needs. So on those days when, I feel a bit tired and worn out myself, I do get energy from the team because, the good thing is we haven't all felt at that same place of being burnt out at the same time. It's kind of moves in ebbs and flows, right? So those of us who have energy for that particular day or that moment certainly support our fellow colleagues and encourage them on the front line. We've tried to introduce internal programs to support the staff. Different speakers come in, talk about self-care, talk about managing burnout, managing stress. We have implemented this internal code, like in hospitals, you tend to have codes for every event that happens. But in our case, we have this code lavender approach where any staff person can just, call a code lavender, which means that they need some immediate support in the moment. Wow. And then we have internal people who come and just kind of support them and talk them through a situation that's really difficult, or just, encourage them, or just maybe, just advise them. Maybe this is a good time for you to take a little bit of a break and, a couple of mental health days, and then see how you feel and, come back to the line of duty at that time. So a few different mechanisms. The good thing is, it's not all on me, but the staff support each other from a peer-to-peer perspective. I get a lot of support from also my like-minded colleagues in the community healthcare sector. We're constantly meeting at different tables, but oftentimes we'll take a moment just to check in to see how each of us is faring in this environment. And then, of course, I have the soft place to land, as I call it, which is my own family. When I get home at the end of the day, my partner and my children, children will always have a way of leveling you out, just their mom, right? And so having to turn up to support my children, just to, be their mom on a day-to-day basis, is also a great thing, because it takes me out of that sort of professional mode into a family mode, which is a good transition for me to have some balance in my life.
I love that, that code lavender that you implemented at Vibrant Healthcare. And have you noticed that a lot of people have been using it? Like, what has the uptake been? How open have staff been to ask for help?
Staff have been great. Sometimes I'm not necessarily aware that they ask for help, but I just kind of, in my observation as I'm walking around the organization, or I'm hearing, updates at staff meetings, that's where I get the feedback. And because we've had a couple of staff that sort of really champion that Code Lavender model, they also will be the ones that directly check in with people, because sometimes people are just not having a great day, but it's not something you'd like to bring to management attention, right? It's something that you're trying to resolve either inwardly or amongst your peers. So you'll see people are, having conversation. We, of course, encourage people to have those conversations safely, social distance. So it's not like they're physically, close and in a huddle, but we can sometimes see times where just outside my office door, for example, which is a large open meeting space, that you might see 2 or 3 people safely social distance there, just, having a conversation. So sometimes with my ear to the ground, I actually hear the ways that staff are supporting each other. And I feel very, very good about that. And it's something that I think they do on a regular basis and incorporate into their day-to-day work without it even being so obvious all the time, right?
Right. And for you as a leader and your senior management team, you said you rely on a lot of those supports in the community. You sit on, those common tables, and it's a lot of informal support. Are there any other formal supports that you wish you had in place, like, a group for leaders to come together and maybe share their experiences or share with each other tips that might have helped them, things like that?
Yeah, that would be great. I mean, we are all about the business of, healthcare and keeping people safe in this COVID environment, particularly. So I think, having that opportunity to convene in a way that is more informal, as you suggest, where we're just talking about how we're doing, right? That would be a great thing. There are not many of those, tables that have been convened in a structured way. But like for me as a Black woman, there are tables of, Black health leaders that I could plug into and get that support. And people ask me, how I'm doing, because unfortunately in this environment, we're still having some, of the experiences that we have, day to day around dealing with racism, dealing with people's attitudes about, just who you are or the skin that you're in. So we do have places where we need to debrief those experiences of microaggressions that we might experience every day. And so that particular table of Black health leaders is also one of those safe spaces where you could just literally, be who you are, let your hair down, and talk about a specific experience that you're having in order to get the support from that particular peer group.
Right, which is so important in our own healing, right? Like we need that space, that supportive environment to be able to share those experiences and sort of live through them. Versus, that's where the aggression sometimes comes in when we don't fully understand what we're experiencing.